Kids get hurt. They just do. It's part of being a kid.
But it's your job as a babysitter to watch them carefully, so you can try to prevent them from getting hurt if you can.
It's also your job to know how to take care of them if they do get hurt. Coming up, we're going to show you how to take care of different kinds of injuries and illnesses that are pretty common among young children. Where should we start, Em?
Bleeding is about as common as it gets. Let's start there. First, a bloody nose. A nosebleed can come from falling or getting hit in the nose, or just from breathing dry air. But sometimes they can happen for no clear reason. In most cases, you can control the bleeding. Have the child sit with his head slightly forward and pinch his nostrils together for about 10 minutes. You can also try putting pressure on the upper lip, just beneath the nose. Or apply an ice pack to the bridge of the nose. Be sure the ice pack is wrapped in a towel.
Bleeding injuries are called wounds. Bleeding underneath the surface of the skin is called a closed wound in first aid speak. You and I just call it a bruise. This type of wound doesn't usually need much care, but a cold washcloth or an ice pack might help ease the pain if the bruise just happened.
An open wound is easy to recognize because the surface of the skin is broken and you can see the bleeding clearly.
The most common open wounds you'll see with kids are small cuts and scrapes. They don't bleed very much, but they need first aid attention right away to prevent infection.
I'm gonna put some cloth on your cut, okay?
Use a barrier like a sterile dressing or clean cloth to apply direct pressure on the wound. Hold it there for a few minutes until the bleeding stops. Then, wash the wound with soap and water. Rinse for about 5 minutes with clean running tap water.
I'm gonna put some ointment on your cut, okay?
Apply a triple antibiotic ointment if the child has no known allergies or sensitivities to the medication.
Okay.
Finally, cover the wound with a sterile bandage.
Here.
Most bleeding will usually stop by itself after a few minutes, but if it doesn't stop or if the bleeding looks really bad, have someone call 911 for help and use the supplies in your first aid kit to help control the bleeding.
You'll be okay, it's just a small cut.
Cover the wound with a sterile dressing or clean cloth. Press firmly and keep pressure on the wound until the bleeding stops. Use a roller bandage to bandage the wound. Cover the dressing completely using overlapping turns. Secure the bandage by taping or tying off the end. If the bleeding starts again and blood soaks through the bandage, place another dressing on top of the first dressing and wrap with another bandage. Keep putting pressure on the bandaged wound until EMS personnel arrive and take over. Remember, whenever there is a risk of coming in contact with body fluids, such as blood, wash your hands immediately after giving care, even if you wear gloves. Burns are another common cause of injury for children and infants. Children are curious. They learn about the world by touching and feeling things.
They don't always know what things can hurt them, so you have to watch them constantly to make sure they stay safe.
Matches and lighters, electrical outlets, hot liquids and stoves, even tap water that's too hot can burn a child quickly.
You should always watch for ways to protect the children you're babysitting.
Most burns are preventable. Check the temperature of foods and drinks before giving them to children.
Don't let kids play around stoves, and be sure the pan handles are turned in and on the back or furthest burner away from little hands.
And never let a child play with matches, lighters, candles, or an open flame.
As with many injuries and accidents, burns can happen quickly and unexpectedly. Here's what you should do for different kinds of burns. Burns from heat, called thermal burns, are the most common. Fire, steam, hot liquids, and hot surfaces are some common causes of thermal burns.
What happened? Are you okay? Here, let's run underwater. Let me test it first.
Exposure to certain chemicals, such as drain cleaners or oven cleaners, will also cause burns.
In addition to causing burns, electricity can also damage internal organs and cause damage to the heart.
Radiation is another cause of burns. The most common type of radiation burn is from too much exposure to the sun. The depth of the burn determines how serious it is. Generally, there are 3 levels. Minor burns affect only the surface layers of the skin. Burns that are more severe form blisters and affect deeper layers of the skin. And the most severe burns affect the skin and soft tissue down to the bone.
Burns can be life-threatening for a child, so always call 911 or the local emergency number immediately if you think a child has been severely burned.
Caring for most burns is not complicated. Just stay calm and remember, stop the burn, then cool and cover. Cool the burn, then cover the burn. Watch Mimi again and notice how she handles Emily's hot water thermal burn. Remember to check the scene for safety, since you could also be in danger from the heat, chemicals, electricity, or radiation that cause the burn.
What happened? Are you okay?
If you can do it safely, remove the source of the burn. Cool and cover. Cool the burn under cold running water as quickly as possible. Once the burn has been cooled, cover the burn. Place sterile dressings and loosely wrap the burns with bandages to protect the injured area. There are a few things to remember for certain types of burns. If the burn is caused by chemicals, use lots of running water to rinse the chemicals off thoroughly before bandaging. Rinse the area for at least 20 minutes.
A burn caused by electricity can affect breathing and heart function and cause serious internal injury. Do not touch the child until you are sure he is no longer in contact with the power source or the electricity has been turned off at the source. Check for life-threatening conditions, such as unconsciousness, no movement or breathing, before you cool and cover the burn. Continue to monitor the child until EMS personnel arrive, in case the electrical shock has damaged the internal organs, especially the heart.
If you're going to be babysitting outside, ask the parents for permission to use sunscreen on the children. They may prefer to use a certain type of sunscreen, especially if their child is sensitive or allergic. When using sunscreen, make sure to apply plenty of it from their faces, necks, and ears to their feet.
And be sure to put on more sunscreen, at least every 2 to 3 hours, especially if the children are playing in or around water. Water-resistant sunscreens lose their effectiveness after 40 minutes in the water, and waterproof sunscreens lose their punch after 80 minutes. So keep an eye on the clock and reapply that sunscreen in time.
If you have any questions about burns, your classroom instructor will be happy to answer them for you.
See ya! Hey Mike, have you ever been in the emergency room?
Sure was. When I was 6, I thought I was a superstar skateboarder. I built a ramp in the driveway. It looked awesome. But I guess I didn't use enough nails because the first time I tried it, the whole thing collapsed.
No, what happened?
14 stitches, 1 sprained ankle, and the end of my career as a superstar. I was on crutches for 2 weeks.
Ouch.
Yeah, ouch.
That makes you the resident expert on first aid for sprains. Why don't you tell everybody what to do for injuries to muscles, bones, and joints?
You got it, Em. Watch this, you guys.
Careful, not too high.
I bet you I can touch the sky. Watch this. Ah! Ah!
Injuries to muscles, bones, and joints are common among active kids. They can be very painful and may or may not be serious.
Well, try not to move. Let me take a look. Serena, get me a phone and a first aid kit. Oh, I know it hurts, buddy. Just try to relax.
Always suspect a serious muscle, bone, or joint injury if the child cannot move or use the body part normally, or if there are visible bone fragments or the feeling of a snap, pop, or bones grating. The injury could be serious if there's a lot of bruising and swelling or obvious deformity, if the injured area is cold and numb, or if the cause of the injury makes you think it might be severe, like a vehicle accident or a serious fall.
To care for an injury to a muscle, bone, or joint, remember RICE. It stands for rest, immobilize, cold, and elevate.
Just lay back and try to relax. Okay?
Rest. Avoid movement of the injured area. Do not straighten the injured area. Immobilize. Keep the injured area as still as possible. Stabilize the injured area in the position found. If the child must be moved and if it does not cause more pain, immobilize the injured body part with a splint. We'll talk more about splinting later on.
I'm gonna put a cold pack on your leg.
Cold. Apply ice to the injured area for about 20 minutes. This will help reduce pain and swelling. Place a thin barrier between the ice and bare skin. Finally, elevate. Elevate the injured part only if it does not cause more pain. This can help reduce swelling.
Your mom should be coming soon, and just take her to the doctors to get checked out, okay?
Almost everybody who spends time outside has been stung by a bee at least once. Bee stings can be painful, but most of the time they're pretty easy to care for.
Here's what you should do if a child in your care is stung by a bee.
Ow, a bee! Mo, a bee stung Megan.
Are you allergic to bee stings?
No, she's been stung before.
Okay, good. I need you to get the first aid kit and a kitchen towel for me.
Okay.
Here, come on, sit down. Let me see.
When a child is stung by an insect, remove the stinger as soon as possible. Remove the stinger quickly by scraping it away with a fingernail or a plastic card, such as a credit card, gift card, or school ID. If you don't have a plastic card, you could use tweezers, but make sure you only grasp the stinger's shaft, not the venom sac. Do not push, pinch, squeeze, or further embed the stinger into the skin, as this may cause more venom to be injected into the child. If possible, wash the site with soap and water. If soap and water are not immediately available, apply an antiseptic wipe or triple antibiotic ointment to the sting site to prevent infection. Cover with a bandage or dressing, then apply a first aid cold pack or ice, wrapped in a towel over the sting. This will help ease the pain and reduce swelling. With any insect sting, an allergic reaction is possible, even if the child hasn't had a reaction before. Watch the child carefully for signals of a severe allergic reaction. If you notice that the child starts to have difficulty breathing, the face, neck, throat, or tongue begin to swell, or if the child breaks out in a rash, hives, or itching, call 911 or the local emergency number immediately. There are other signals that a child is having an allergic reaction, but we'll talk more about that later. For now, you've got the bee sting basics under control.